To date, there is no proven treatment for the novel coronavirus that has killed more than 100 people in China and sickened thousands. But scientists are learning more about it, and now they're working to develop treatment options. On January 10th, China published the genetic sequence of the coronavirus strain. Scientists at the National Institutes of Health and the CDC used that to develop a rapid diagnostic test, like the rapid flu test at your doctor's office, but much more sensitive and specific. Right now, it's only available at the CDC, but health officials said it could be available at the local level in a week or two. In the meantime, NIH and companies like Johnson & Johnson are using that genetic code to test vaccine and therapy treatments. The University of Queensland in Australia, Moderna Therapeutics, and Inovio Pharmaceuticals are working with up to $11 million in funding from the Coalition for Epidemic Preparedness Innovations, too.
Again, I must emphasize, there's no proven efficacy of these, but they are being pursued together with the screening of a number of other agents. I might point out that is why it is so important that we get isolates of the virus, which we will soon have, both particularly from the individuals in this country who have now been infected.
Researchers have also been looking into antiviral medication based on current HIV treatments. It would block the proteins that coronaviruses need to replicate. U.S. drug maker AbbVie has sent more than $2 million worth of antiviral HIV drugs to a hospital in Wuhan, China for a controlled trial. The CDC is also testing monoclonal antibody therapy, which is used right now in cancer treatments. Scientists clone a stock of antibodies in the lab, which can then work just like the patient's own antibodies, helping their immune system attack sick cells. So far, health officials say these antibodies have only been tested in vitro and in animal models. U.S. health authorities expect the most promising treatments could head to clinical trials in the next 3 months, and a mass vaccine is probably even further off. Testing it properly could take months or even years.
We are proceeding as if we will have to deploy a vaccine. In other words, we're looking at the worst scenario, that this becomes a bigger outbreak.
现在时间是晚上8点33分。
8点33分开始荣耀啊。
2月6日晚间，武汉金鹰潭医院正式对一名68岁男性重症患者展开可能是目前对新型冠状病毒肺炎出现明显疗效的临床试验。
现在大家所期望的瑞德西韦这个药呢，我们就在今天正式开始了它的临床试验，期望呢能够尽快的给大家一个科学的结论，它有效与否。
根据医学杂志报道，由美国药厂吉利德科学公司研发的实验药品瑞德西韦，让一名30岁的武汉肺炎患者临床症状大幅改善。消息一出，全球瞩目。而这一款原本研发用来对抗伊波拉病毒的用药，幕后研发的关键人物还是来自台湾的女科学家杨台莹。
瑞德西韦，多家医疗机构正在就这个药物组织开展临床试验，以期来研究药物的安全性和有效性。
有一些实验室的东西直接用到临床，是不是要谨慎一点？作为临床医生，还是要按照临床的规矩来做。
瑞德西韦究竟是不是武汉肺炎的特效药，目前还是未知数。但在此同时，瑞德西韦药物的专利权却出现武汉病毒实验室在与美国吉利德药厂争抢大陆地区专利的争议，意外成为疫情疗效外的焦点话题。记者综合报道。
There's this letter to the editor to Nature. Nature's a big journal, very prestigious. This is February the 4th that this was published. And it is describing the medications, specifically Remdesivir and chloroquine, and why this is important. So let's talk about Remdesivir first. Going back, there were a number of medications that were looked at during the SARS and MERS outbreak, both of which, by the way, are coronaviruses. There were medications that they had tried like ribavirin. Obviously, they had tried Remdesivir as well. And these were shown to be efficacious in stopping viral production in vitro. So the key there is the word in vitro. In vitro means in a petri dish, in a test tube, not necessarily in a human being. And this is where a lot of tests are done at first. Now, what they did do is they looked at this medication called Remdesivir, and they tried it in Ebola. And the reason why they did this was because it worked in Ebola. It worked in vitro in Ebola. And they said, hey, maybe we can try this in Ebola patients or in people who are in proximity to people with the Ebola virus so that they don't get Ebola. And so when they tried it, it didn't work. Okay, people still got Ebola. So that's an example where a medication works in vitro but not in vivo. Nevertheless, before they could take this medication, Remdesivir, to market, before they could even try it in these patients, they had to make sure that it was safe. And so the safety tests have already been done on Remdesivir. We know that it's a relatively safe medication to use in patients. The problem was it just didn't work in vivo, in patients in real life. But it did work in vitro against a bunch of viruses. So enter in now the coronavirus 2019, and you've got a situation where people are dying and there's an epidemic. Why not try Remdesivir? Well, the first thing you've got to want to do is to make sure this medication actually works against not the SARS, not the MERS, not Ebola, but the actual coronavirus 2019. And so that's what they did. They actually tried it in cells that were infected with the current strain of the coronavirus from Wuhan, China. Now, how does this medication work? What does it do? So you've got the cell and you've got the virus, and the virus has to fuse with the cell and it goes inside the cell. And when it does that, it basically dumps its RNA into the cell and uses the cellular machinery to reproduce more RNA. Well, for those of you who are aware of what RNA is, or DNA for that matter, it's basically just a code. And you know, the DNA code, for instance, is like A, T, G, C, and this can go on and on and on. With, however, RNA, instead of having the T's, those T's become U's. So instead of T's, you'd have AU, GC, UU, okay? That's the only real difference, and of course, it's usually single-stranded, and DNA is usually double-stranded. So what happens is that these nucleotides are lined up one after the other, and there are, tRNAs that come in and help put the nucleotides in the correct order, and this is done using different polymerases. Well, what this medication does is it resembles one of the A's, except it doesn't allow the next one to come on, whatever that happens to be. So the virus comes into the cell and it says, aha, I'm taking you over, and you're going to start to produce more RNA viruses like me. And so the machinery starts to go along, and as soon as it gets to an A, this medication gets put in, and boom, it's done. There's no more polymerization. The strand cannot continue, and so this arrests the production of virus. Well, the good news is that they found that this worked well in the new 2019 strain of the coronavirus. And so here you've got a medication that has already been tested on human beings for safety. It's available. It's there. You just don't have a good FDA indication because it doesn't work on Ebola, and you don't have a SARS outbreak currently, but now you've got this coronavirus outbreak. So what do? Even though they don't have any evidence that it's going to work, and usually we only give medications to people when we have evidence that it works, they use it for something called compassionate use. In other words, look, this patient's going to die. Let's give them this medication, see if it works. So they did that. They did that in the first patient in the United States that came down with the virus, and it was in Washington State. And within a day, this patient started feeling better, and within 3 or 4 days, the fever completely went away. And we've got a number of articles that talk about this, and we'll put those in the links. So this could be a big breakthrough here if this works. But remember, want to make sure that you understand that this medication has never worked in vivo. So we don't know if it's going to work. So what they're planning on doing here coming up very shortly is they're actually going to undergo a trial in China where they give some people placebo and they give others this Remdesivir and see whether or not it works. We should know by the end of April whether or not this thing is going to work. Now, as you can imagine, this has caused some stir. The company is Gilead that makes this, and I'm sure if you look at their stock prices, they're probably going up. in the hopes that this thing works and that the epidemic can be abated. So the other drug that they looked at in the same letter to the editor in that study was chloroquine. Now, chloroquine has been around for a very long time. It's a generic medication. It's been used in malaria for years, in fact, so much so that you actually have chloroquine-resistant areas. They also found that this worked really well as well. So how does that work? Well, you've got the cell, you've got the virus. There's a special pH that these lysosomes have to be before these things can merge. And what chloroquine does is it raises the pH of those lysosomes, preventing these things from merging. So it's possible that you could prevent viral particles from infecting other cells. Now, these are just two drugs that are being looked at. There's lopinavir and ritonavir. These are other medications that are being used. In fact, these were used in Thailand, and they were thought to improve. The problem is with any of these medications that are used for compassionate use, if you use them and the patient gets better, you don't know if that was the reason why they got better or if it was some other reason they got better. That's why you need to do a randomized placebo-controlled trial. Okay, so this is the latest hot off the press information regarding coronavirus. If you found this is helpful, if you found this channel is helpful, please subscribe, and that will help us make more of these videos and continue the updates as this saga unfolds. Thanks for joining us.
基督教医院先前收治一名在1月25号发病之后确诊武汉肺炎的52岁女性台商，最近将个案的治疗经验投稿到国际顶尖新英格兰医学期刊，指出医院方面采用了抗流感药物、克流感主成分奥司他韦以及抗生素左氧氟沙星来治疗患者，结果病情明显改善。
包括胸部 X 光片啊、临床抽血检验啊，到他现在的整个治疗状况的过程，做了一个完整的陈述的报告，在一个国际专业社群上，这样的资料是非常有价值的。
彰化县府卫生局方面指出，张基将治疗经验发表在国际的医疗期刊，受到重视。根据了解，收治病患的彰化基督教医院治疗患者前有参考卫福部疾管署还有世界卫生组织 WHO 的治疗指引。不过最后他以自己的经验以及灵感使用药物。这名女患者有鼻塞、流鼻涕的症状，临床表现和流感非常相似，因此医生先给予她奥司他韦，而且患者合并肺炎。为了掌握治疗的先机，在没有充分厘清到底是病毒或是细菌感染的情况下，赶紧先给予抗生素左氧氟沙星。由于中央流行疫情指挥中心尚未对轻症患者定出治疗指引，仍有医生依患者临床的症状给予适当治疗。
至于重症的部分，是美国有一例恶化之后所使用前治疗伊波拉病毒的药，看起来有效。所以这个药的话，就我们所知道，它应该也送去中国大陆，只看对重症的病人有没有效嘛。
国内医界也有共识，如果往后收治到重症患者，将优先采用治疗伊波拉病毒的瑞德西韦，主因是这个药物同时也可以抑制新型冠状性病毒的复制，达到治疗效果。东森新闻陈永义、肖光志彰化报道。
泰国已经研究出可以治那个肺炎武汉病毒。大家好，我是曼谷鸭阿弟，今天又跟大家讲这个新闻，就是泰国能成功研究出可以治疗肺炎武汉病毒。我们先来看这道新闻，这是2月2号下午的一个新闻，就是泰国曼谷一个医院拉瑞提可以研究出一个很好的治疗方法。新闻说到，就是这2位医生在治疗一位病人，然后发现用2种药可以医好。2种什么药呢？医生说不是新药，是2种老的药，在泰国已经有的药。医生们用同样的治疗方法，在另外的几位病人。谢谢大家收看我的视频，请按关注我。
มันเป็นยามาตรฐานที่ใช้อยู่แล้วก็มีรายงานการใช้ยานะครับส่วนยาต้านไวรัสที่รักษาโรคเอดส์ก็ทางจีนก็ใช้อยู่แต่ว่าเราไปมีการเปิดดูข้อมูลว่ามันมีรายงานว่ามีการรักษาในกลุ่มโคโรนาไวรัสในกลุ่มที่เป็นกลุ่มเมืองที่เคยระบาดแล้วมันได้ผลได้ยาต้านไวรัสไข้หวัดใหญ่เราก็เลยเอามาผสมกันปรากฏว่าผลดีขึ้นอย่างภายใน48 ชั่วโมงดีขึ้นชัดเจนแล้วก็เชื้อจากที่เป็นบวก10 วันกลายเป็นเป็นลบนะครับ